This video will be explaining features of the pharynx, the nasal cavity, some tonsils, and the larynx. So we'll start off with the larynx. This is the larynx over here, and this is the laryngeal inlet. This is the epiglottis over here, which guards the laryngeal inlet. Here we have the two folds. Superiorly, we have the vestibular fold. Inferiorly, we have the vocal fold. And in between, we have the ventricle. So superiorly over here, as we have mentioned, it's the vestibular fold. The vestibular fold is formed by the quadratus membrane of the larynx. In between, we have the ventricle, and inferiorly, we have the vocal fold, which is formed by the cricothyroid membrane or conus elasticus. Below the vocal fold, we have the infraglottic cavity. So from superior to inferior, the inlet, the vestibule, the vestibular fold. In between, we have the ventricle. Inferiorly, we have the vocal fold, and inferior to the vocal fold, we have the infraglottic cavity. This is for the larynx. Next, we have this area between this depression between the epiglottis and between the laryngeal, between the tongue, sorry. This over here is known as the vallecula. Okay, it's called the vallecula, yeah. Here we have, near the laryngeal inlet, we have the piriformis fossa, and it has got a clinical significance in case someone chokes on food and it goes into the trachea. The cuff reflex would eject the foreign body or the food out, but it may fall into the piriform fossa. Sometimes by accident or by mistake, the interference that is done to remove this foreign body from the piriform fossa may injure a nerve located in the floor of the piriform fossa. This nerve is the internal laryngeal nerve. Next, we have the pharynx. So this pharynx extends from we have the nasopharynx, the oropharynx, and the laryngopharynx. It's made up of musculature, and the nasopharynx is kept patent by the pharyngeo-basilar fascia. Moving on to the nasal cavity, here we have the superior concha, the middle concha, and the inferior concha. Here we have the superior meatus, middle meatus, and inferior meatus. And generally, the air sinuses empty into these meatuses and conchae. Here we have a recess, known as the sphenoethmoidal recess, because it is located between the sphenoid and the ethmoid bone. The superior and middle conchae, they are formed by the ethmoid bone. However, the inferior one is made up by the vomer bone. Now we'll talk about an imaginary plane located over here. This imaginary plane is known as the choanal plane. It's an imaginary plane, and it forms the entry to the nasopharynx. So this one over here is known as the tubal tonsil. By the way, this forms the opening of the eustachian tube or the auditory tube. Anyway, here we have a tonsil known as the tubal. This is the pharyngeal tonsil. This is the palatine tonsil. And this is the lingual tonsil. So we have the tubal, pharyngeal, palatine, lingual. This forms an imaginary circle or an imaginary ring known as the Waldeyer's ring. So the Waldeyer's ring is formed by the tubal, pharyngeal, palatine, and lingual tonsils.